suicide is a major public health problem in the globe. And we know that about 90% of people who committed suicide had some sort of mental disorder. And we also know that most suicides can be prevented through adequate treatment and approaching. The relationship between religiosity, religious involvement, and suicidality have been raised for many decades. There is a classic study of Émile Durkheim comparing the religion prevalent in some European countries and their suicidal rates. But more recently, we have many epidemiological, well-established, well-conducted epidemiological surveys investigating the association between suicidality, suicidal attempt, and suicide, completed suicide, and religious involvement. Usually, the relationship is inverse. The higher the level of religious involvement, the lower the level of suicidality, suicidal attempts, suicidal thoughts, or complete suicide. A study performed in Brazil investigated 110 people who attempted suicide and were attended in hospitals. And they compared the sample with 114 controls. And what they found was that people who had some sort of religious attendance or some sort of intrinsic religiosity, they had half of the risk of suicidal attempt comparing with people with no religious involvement. And the best study to date was published recently at the British Journal of Psychiatry. It's a nationally representative sample of the United States with more than 20,000 people that were followed up for up to 16 years. And trying to figure out which are the predictors of suicidal death, of deaths by suicide. And what they found that the most powerful protective factor regarding suicidal death was exactly religious attendance. People who attended the religious service were, during this 16-year follow-up, they had 1/3 of chance of suicide comparing with people with no religious attendance. Or, putting in another way, people who did not attend religious service had 3 times the risk of death by suicide comparing with people who attended the religious service. So basically we found, and most studies found, that religious involvement is a strong protective factor of suicidal behavior and needs to be taken in consideration when we are dealing with suicidal behavior. Of course, the approach to suicidality needs to be comprehensive with psychological, medical, sociological, but also religious and spiritual understanding.